Hi, my name is Laura Bagwell. Today I will be talking about the patient that I had for my treatment plan. The patient is a 19-year-old female that injured her right knee playing intercollegiate basketball 1 week before the initial evaluation. She had surgery on her ACL with a bone patellar tendon bone autograft 3 days before the initial evaluation. An autograft is when they use tissue from the body of the patient. The bone patellar tendon bone autograft is the strongest type of autograft used for ACL reconstruction surgery. During the initial evaluation, the patient complained of pain that increases with knee flexion and gait without crutches. One of the objective findings during the initial evaluation was decreased mobility in right patella in all directions compared to the left. During the re-evaluation, the patient complained of symptoms with deep squats and fast walk or jog. One of the objective findings of the re-evaluation was that her right VMO muscle mass was less than that of her left. I chose patellar glides in all directions to treat this patient. The rationale is to mobilize the soft tissue that attaches to the patella to help improve flexion and extension of the knee. Medial and lateral glides help to mobilize the soft tissue that attaches to the patella. Superior glides help to improve knee extension, and inferior glides help to improve knee flexion. As I stated before, one of the objective findings during the initial evaluation was decreased mobility in right patella in all directions compared to left. I used grades 3 and 4 to stretch the joint capsule restriction and to increase the osteokinematic motion. This is a lateral glide. It helps to mobilize the soft tissue that attaches to the patella. This is a grade 3 and then a 4. The superior glide helps to improve knee extension. That's a grade 3 and then a 4. The medial glide also helps to mobilize the soft tissue that attaches to the patella. This is a grade 3 and then a 4. The inferior glides help to improve knee flexion. This is a grade 3 and then a 4. During the first treatment session, the patient was educated on symptom management. Before treatment, the patient complained of pain that increased with knee flexion and gait without crutches. It's important to educate the patient on gait with her crutches and knee brace because it will help to reduce her symptoms. One of the home exercises I chose after the 6-week reevaluation was partial squats. The rationale for choosing this exercise is to increase quadriceps and hamstring strength, and it will also move the knee through its range of motion, which will decrease stiffness and help to improve range of motion. The objective finding related to this exercise is that the patient is able to achieve 95% of the range of motion before the onset of symptoms. Also, the manual muscle tests are 4+ in the right quadriceps and hamstrings compared to 5 in the left quadriceps and hamstrings. I'm going to explain this exercise as I would for my patient. Stand with your feet about shoulder width apart and bend your knees and squat down as if you were going to sit in a chair. You want to keep your back straight during this exercise and make sure that your knees are over your toes, directly over your toes, and that they do not go out past your toes. You do not want to do this. You need to go straight down like this. You do not need to squat as far as you can go. Only go to the point where you do not feel any pain. You should do 3 sets of 10 repetitions of this exercise 2 or 3 times a day. This exercise may make your legs feel tired, but you should not feel any sharp pain. If you feel any sharp pain, stop the exercise and talk to your PTA before doing this exercise again. This patient's rehab potential is excellent, and she should be able to return to her previous level of function. The only modification she may need is a knee brace to wear while she's playing basketball so she won't re-injure her knee. The estimated time frame for return to function would be about 6 to 8 weeks from the time of her re-evaluation. After a follow-up visit with her doctor, the only restriction in rehab is to avoid ballistic activities such as jumping and running during the next 8 weeks. Therefore, the patient will not be able to progress to sport-specific activities until her doctor okays it. Thank you for your time. If you have any questions, let me know.